Last night, we heard from Florida's Attorney General Ashley Moody. She's tested positive for COVID. In a statement, she says she was vaccinated earlier this year, and she's just one of many people who are dealing with what they call these breakthrough cases. Join us to discuss all of this, Dr. Jason Wilson, Tampa General Hospital. He's our expert on all of these things, and it's good to see you again. Thank you for your time.
I'm glad to be here. Sorry, it's about this again.
I know. But someday we'll have happier things to talk about, I hope.
That's exactly right.
Yeah. What is a breakthrough infection? Explain that to us.
It's a great question, actually, because these vaccines were designed to keep people from being hospitalized and to keep people from getting very sick from COVID or even dying. For the most part, what we've actually seen is the vaccines are doing what the vaccines were designed and studied to do. The data is actually holding pretty well, which means that people who are vaccinated, for large part, are not getting hospitalized, are not getting very sick from COVID, and are not dying or being put on ventilators. We are seeing some cases of COVID amongst vaccinated patients, but oftentimes those patients are not hospitalized. That's the big difference here, is that when we have a very transmissible strain like the Delta strain, we may see some cases of COVID in vaccinated patients, but for the most part, those patients don't get hospitalized. So big protection against getting COVID. Then if you do get COVID, still big protection against getting hospitalized. If you do get hospitalized, still big protection against bad outcomes happening. And if you were to get COVID, even vaccinated, we still have things like monoclonal antibodies now to possibly provide for risky patients.
You're reiterating this fascinating piece I saw in the Washington Post this morning about all of this. And my takeaway on this from the article, and I think you just said it, vaccines don't make us immune, but less sick.
Yeah, that's basically correct. The vaccines certainly make it less likely we will get COVID, which is great. So we have more immunity than the person who doesn't have a vaccine. But you're right, it's not a foolproof, bulletproof shield. It's a protective shield, and it's giving us high numbers of antibody and memory immunity. So if we were to get COVID, the likelihood is we'll keep that viral load low. We won't transmit to as many other people, and we probably won't end up in the hospital either. People should understand right now that at our hospital, Tampa General, and other hospitals in the area, the people who are being hospitalized right now, 9 to 1, are not vaccinated. That's really important to understand. Our hospitals are being filled with people who are not vaccinated against COVID right now, not vaccinated patients.
Let me ask you this. The ones you are treating in the hospital, these sicker people, is it easier to treat them now than it was when this all first started? Have we got more things in the arsenal to treat them with?
Well, we have some things, but the best treatment we have really is the vaccine, right? Really is the not get it to begin with. Now, having said that, if you were to get COVID, we are in a better place than we were a year and a half ago, a year ago, even in November. Specifically for patients who aren't hospitalized, we have the monoclonal antibodies, and the utilization and use of those has been opened up by the FDA to more patients beginning in June. So if you were to get COVID and you were vaccinated, you'd still have that to try to keep you out of the hospital too. For our hospitalized patients, a lot of the care we provide is just simply getting better at providing care in general for a specific disease state. I mean, we've seen so much COVID now, we kind of know what to do and what to expect. So things like proning patients, giving steroids when people are on oxygen, giving some special antibody treatments and infusion treatments, antivirals in the hospital setting. Those things become kind of our arsenal to combat COVID. But really prevention and a readily available preventative strategy like vaccines, that's the way to go right now.
Hey, we got to go. Dr. Wilson, thanks. Doc, always good to see you.
Anytime, Russell.
We'll talk again soon,
great to see you too.
Take care.
Anytime. Bye.